Welcome to the Listen Up podcast, where we explore hearing loss, communication, connections, and health.
Hi, Dr. Mark Sims here. I'm the host of the Listen Up podcast, where I feature leaders in healthcare. This episode is brought to you by Arizona Hearing Center. I help patients to effectively treat their hearing loss so they can better connect with their families and friends and remain independent. The reason I'm so passionate about hearing loss is because I lost my brother Robbie twice. First to the hearing loss from his radiation to his brain tumor, and then later to complications from that radiation. I am an otolaryngologist who just practices the E of ENT. I'm an otologist. I only do ears. I've performed over 10,000 ear surgeries in my career and treated thousands of patients with hearing loss, and I'm passionate for you to learn how to treat hearing loss better. I'm the author of a book called Listen Up, A Physician's Guide to Treating Your Hearing Loss. If you want to learn more about that, you can go to www.listenup.com. If you want to learn more about my practice, you can go to www.azhear.com. Today, I'm really excited. We have Dr. Derek Hewitt. He is a board certified otolaryngologist. He obtained his medical degree from the University of Utah and did his ENT residency at the University of Missouri Hospital and Clinics. He practices at Prescott ENT. He's an excellent colleague, takes great care of patients in the area, and I'm excited to have you on the show. Derek, welcome.
Thank you so much. Good to be here.
Oh, great. So tell me, how did you end up in the world of ENT? So what was your path to being a physician and then ENT specifically?
Well, my path was probably a little circuitous. I didn't quite get the itch to go into medicine until I was early 20s or so. And it took me a while to kind of figure out how to get there. I never knew any doctors. No one was a doctor in my family, and really no professionals. So
what'd you do before?
Find my own way. Well, I went on a mission for my church for 2 years. I'm LDS, so I did that from the time I was 19 to 21. And then I started college after that, and kind of took a while to work and get myself through college and figure out what I wanted to do. And it was probably the last year of my college career when I really decided that this is what I wanted to do. I graduated with an English degree, which I actually recommend for anyone because just was really good for me.
They grade hard.
Wait, what's that?
The professors grade very tough in English, though.
Yeah, there's a lot of critical thinking skills you learn in English that maybe you learn in other areas, but that was really important for me. So after my undergrad, I had to go back and do all the science stuff. That took a couple years. And then I actually ended up getting a master's in public health before I went into medical school.
Okay. So
a little circuitous route, but I got there in the end. And I thought I was going to do pediatrics. So that was my goal. And then my third year of medical school during clerkships and stuff, I just, after pediatrics, it was just not an interest anymore. Maybe it had to do with the fact that the Twin Towers came down during clinic. And I remember watching that happen when I was in clinic in my pediatric rotation. But nonetheless, I had a professor come my first year of medical school. In fact, professors in different specialties came to visit and they spoke to us about what they do. And the ENT, head and neck surgery, sounded really interesting. I like the variety of what I do. I like seeing lots of different patients. I like doing the surgery. I'd say the technical stuff really is enjoyable and satisfying. And that's why I went into it, and that's why I still do it.
Yeah, you get to treat people from all age groups, which is really awesome. That's what I love about ENT. Yeah. And so you did your residency in Missouri, and then you were looking for a place to settle. How'd you end up in Prescott?
Well, after residency, I spent about 3 years in Spokane, Washington. And I think you know a couple of the doctors I worked with up there.
Neil Giddings.
And Mike Olds. Michael Olds.
Right.
Maybe, but so I worked with them for 3 years, and I just had an itch to practice more broadly what I learned in residency, and really try to firm up my skills. And so I looked around for a different place to practice. That's what I really like about practicing in Prescott. I feel like I get to do a lot of what I learned in residency and stay up on it and consistent. And I've been here 10 years.
That's awesome. Yeah, that's great. And, as somebody who receives patients from you, I'll tell you, you do a great job taking care of them up there. And I appreciate
Thanks.
the referrals, but I know they also appreciate the great local care, which is really important, right? People want the local care. So, everybody has kind of, maybe that impactful patient story or two. Do you have any that you can put in your head that is just like a great story or funny? I mean, people ask me, I tell people I had a patient who had a key fob put into his mastoid bone in a fight, right?
A key fob.
Yeah. So I not that it's just because it's so crazy. It doesn't have to be crazy, but we all have those patients that make impressions. Is there anyone that obviously through anonymity, but any patient stories you like to tell or have?
I probably the thing that comes to my mind is patients who are there's a couple of patients that come to my mind. A few years ago, I saw that one of them particularly was an older lady. She had laryngeal cancer, carcinoma of the voice box, right? And she really needed a laryngectomy. And I really, really begged her basically to go down to Phoenix and get it done, because it'd been, about 5 years or so since I'd done one.
Right.
Yeah, I felt like I could do it, but of course I'd have to put the time and study and prep into it. And I don't do it a lot, of course, but she really resisted going down to Phoenix. And she, looked at me and said, "I want you to do it." And, I debated, of course, but she wouldn't go. So I ended up doing it. Everything went fine and she healed up great and she's done great. But probably just her faith and in me and her willingness to put herself out there and trust me, and that impresses me about what I do, and people that come in and they really trust you with personal details and their private stuff. And it's amazing to me that
I agree 100%. I say this job, we all have our complaints, but where else do you get to put person in a room and they start telling you their deepest secrets in terms of not on purpose because it's intrigue, but they're willing to entrust you with that information with the hopes of you improving their lives. I mean, it's a pretty awesome thing to get to do. I really think that's one of the many great things about being a physician. Yeah,
I agree.
So you on your day, what are the things that, get you jazzed every day when you go to work and work? What are those types of things?
What gets me jazzed?
Yeah.
Thursdays get me jazzed because that's when that's my surgery day.
Okay.
So I just really enjoy that. I love being in the operating room. I love the technical aspects of it.
So what's a typical day for you in the OR? What type of things are you doing?
Septoplasties, turbinates, sinus surgery. I love a day where I get to do a thyroid, maybe an ear surgery, sinus surgery, kind of the broad kind of thing of ENT. That really gets me jazzed. I love doing that thing. And that's probably what I look forward to the most.
Okay. And so tell me a little bit about your mentors. So who are some of the mentors in ENT? Like if you wanted to look back and thank them, who would they be and how did they contribute to your career?
Probably the first one in medical school, Stephen Gray. He was an otolaryngologist at the University of Utah. And I hooked up with him early in medical school.
So he's the one who came and talked to you about being an otolaryngologist?
Actually, it was another one. It was Dr. Smith.
Oh, okay.
I hooked up with Stephen Gray because he was doing research on vocal cord senescence and aging and stuff. And I helped him on some research projects. and just interacting with him, his demeanor was inspiring. His respect for other people inspired me. I really took a lot from him. Then the head of the department, the chair, was Dr. Davis, and he also just was very encouraging, and gave me a lot of trust and encouragement along the way. And those two people, probably, I think. Of course, boy, residency. I mean, residency. There's so many professors in residency. Sure. Jerry Templer in residency was probably one of the senior professors I worked with, and he was from Texas, and he had this accent and this way with people, and he had all these one-liners that I can't remember them all, but he would just whip them off his tongue and just crack everyone up. And everyone in residency just you learn a lot from everybody.
You do, right? How to practice medicine, and unfortunately, sometimes how not to on occasion, but usually.
Yeah. That's true.
Yeah. So that's great. And so, when you tomorrow, you see patients from all ages, or what type of spectrum of patients do you see?
Well, I think being in Prescott and the retirement community that it is, I obviously see more, older patients. That was, I knew it was a retirement community when I moved here. It was a little surprising at how much, but it's been fun. I see kids when they come, pediatrics and stuff. There's not as much here as I would like, but right. That older spectrum definitely is big here.
And so what are some of the other, do you do, allergy and those other areas as well, or?
Yeah, allergy, and recently started doing sleep, the Inspire device. You've heard about the Inspire. So we just started doing that this year.
What's that? And tell me a little bit about it. I've been out of that world for a little bit.
The Inspire device came out in 2014 to treat sleep apnea that's unresponsive to CPAP and BiPAP. I like to call it a pacemaker for the tongue. So it's a generator like a pacemaker. It's about that big, and it's implanted into the chest, and it has a sensor that goes into the chest wall, and it senses your respirations, and then it has an electrode that goes up to your hypoglossal nerve, and every time you inspire, hence the name Inspire, every time you breathe in, it causes your tongue to protrude and basically moves out of the way so that you can breathe. It's amazing.
Are you having great success with it?
Yeah, I started trying to get it approved in Prescott about 3 years ago. Just took forever, jumping through hoops, and then COVID happened and stuff. So it finally came to fruition this year, and I started doing it the last few months. I had 4 patients. It's just goes smoothly, and so far the patients love it. They don't have to wear the mask, claustrophobia, anxiety stuff. They're very happy with it.
So for our non-ENT listeners, so what would be some of the symptoms people would have for sleep apnea that would lead perhaps down the road to see you for sleep problems?
Yeah, that's a good question. Well, sleep apnea typically will cause daytime somnolence, falling asleep easily, reading a book, falling asleep riding in a car. Some people will wake up with a headache in the morning. That's due to low oxygen saturations that are circulating around in your brain at night. It can obviously affect your cardiovascular system because the pressure that's put on that constantly throughout the night, it doesn't give if you're not getting into that deep REM sleep, your body's not relaxing, right? And your sympathetic tone is always high. And if it doesn't relax at night and it's always high, then it leads to hypertension, atherosclerotic disease, even stroke and stuff. But symptoms mainly are going to be daytime tiredness and headaches and stuff.
Okay, so if people have that type of stuff, they should maybe start with their primary care doctor, get a sleep study, and see what it shows, right?
Yeah.
So that's great. That's a really cool device. And so you've had some success. And how long does the surgery take? Just I'm not that familiar.
Well, that's a good question. My first surgery took about 4 hours, and my recent surgery took about an hour and a half. I anticipate that as I get more familiar with it and stuff, I'll get down, probably be about an hour or so.
Well, that's fun. I mean, that sounds great. Like, especially that's a great example of just repetition and getting better and becoming a student of surgery, right?
Yeah.
So that's really great. And and tomorrow you're doing some sinus surgery, right?
Yeah, tomorrow is a sinus day. So some maxillary antrostomies and frontal sinuses and septoplasties.
I assume there's a lot of sinusitis in the Prescott region.
Yeah, I think there is.
Yeah, so well, that's great. Well,
keeps us busy.
One of the questions I like to ask everybody is what's your favorite sound?
What's my favorite sound?
Yeah, well, I mean, it is listen up, so we
well, that's an interesting question. Sound. So should this be like just a single sound or
whatever you want? Somebody told me the purr of a Porsche. Somebody told me the roaring of the ocean. Another person told me wind going through the trees. I mean, the point is, as we tie back to some hearing loss, whatever people's favorite sound is, if you have hearing loss, it'll likely leave your life. So that's why I always ask people what their favorite sound is.
So what comes to mind is I probably don't have a favorite sound, but
fair enough.
I think it depends on the situation and the setting.
All right. And tell me two situations and settings where your favorite
sounds have meaning, right?
Yes.
And hopefully. Sounds they evict emotion, they bring back memories. Sounds can be irritating and annoying and anxiety provoking, or they can be soothing and stuff. So all of those things you mentioned. Recently, I was in Costa Rica at the beach, the waves, just the repetitive waves, that's soothing and stuff. But that brings on a different emotion and
laughter, for instance.
Yeah, I mean, the roar of a car, a souped up car or something, that's absolutely fun too. So
yeah, mine was laughter. So everybody has their own, but no, that's great. You're absolutely right. It's a more nuanced question or answer than just what's your favorite sound, right? So it's contextual in terms of what you're thinking about, right?
Contextual, yeah, for sure.
Yeah, that's great. And so if you were to win a Lifetime Achievement Award, who would you thank? If somebody said, okay, Derek, who would you thank? You got up to the podium. Who are the people you would thank for where you are in your life?
My mom and my wife, for sure.
Oh, that's great.
That'd be the first ones. I mean, that's where the foundation comes from, right? That's where any personal success is always related to, who's behind you, who's supported you, who's taught you.
Cheerleaders, right?
Who's your cheerleaders? Yeah.
That's great.
For sure.
Yeah, that's awesome. So this is Derek Hewitt, Dr. Derek Hewitt from Prescott ENT. Dr. Hewitt, if people want to get a hold of you, how would they do that?
Our number here at Prescott ENT is 928-778-9190. And we're on Iron Springs Boulevard up in Prescott, right next to
website.
What's that?
Do you have a website?
Yeah, sorry, PrescottENT.com.
Okay, so if people want to go see him, those would be the places. He'd be great to see, practicing the full breadth and doing it on an excellent level, which is really great to hear. And I love your enthusiasm about the whole field. I think it's really amazing. As you know, I'm a subspecialist. I do ears, but I do love the fact that I get to see a broad spectrum of patients, right? And so I actually am empathetic to you about being a pediatrician. Although I love children, I love the fact that I see children, young adults, mid-aged adults, elderly adults. I mean, I love the whole, people ask me, who do I take care of? And I say, cradle to grave, I'll take care of them.
Yeah, exactly.
And I think that's really a privilege in ENT, one of the many, I feel so lucky and blessed to end up in this specialty. And it sounds like you're very enthusiastic about it too.
Yeah, it's fun. I mean, we have a fun specialty, right?
Yeah.
We don't, at first I thought I'd go into general surgery or something like that, but I didn't want to, I wanted to have a family and didn't want to be gone all the time. So, I mean,
I follow the happy people.
Yeah, the happy people.
That's what I did, right? And that's what you're accounting for, right? This guy came to you in your first year of ENT or at medical school, and he seemed like a happy guy, had a pretty good life. You're like, hey, I should think about that, right?
I think it's funny how in medicine, we talk about stereotypes and we try to resist stereotypes and stuff, but I feel like in medicine and in surgery especially, there really are kind of stereotypes, and ENTs that are generally happy and steady and in good moods, and other specialties aren't always that way.
No, we have a great tribe, very much so. The tribe of ENTs is really wonderful. And that's actually one of the reasons why, I'm talking to some other people in the hearing space, but one of the reasons I want to talk to ENTs is because I really do like talking to my tribe, right? The people who do what we do together, and, talking about life as an otolaryngologist. I mean, I learned a lot about the Inspire. I didn't know that much about it. I mean, I'd heard about it, but, as you know, it's a little bit out of my lane, but I always like to keep on top of what other people are doing. And that's another part of these conversations. So
tell me about yourself. You've been in Phoenix for a while, right?
Yeah, so I've been in Phoenix for 20 years, basically solo otologist, obviously take care of people in and out of town, and have been blessed to do the full breadth and depth of otology, right? I don't do as much, of the bread and butter. I leave tubes and adenoids for my otolaryngologic colleagues, for you guys to do by and large. But, obviously, typically revision tympanoplasties, not primaries, sacculoplasties, stapes, cholesteatomas, acoustic neuromas, cochlear implants, other implantable hearing devices, the whole gauntlet. So, and I feel really blessed. And you know what? I really do enjoy going to work every day. And guess what? Thursday is one of my operating days too. So I have a full lineup of ear surgery tomorrow, and I'm very excited too. So
I'll be thinking about you tomorrow.
Yeah. So, well, this has been great, Derek. Thank you so much, everybody. This is Dr. Derek Hewitt from Prescott ENT. We really appreciate you coming on the show, and thanks again for coming on.
Yeah, you bet. Thank you, Mark.
Thanks. Appreciate it.
Thanks for tuning in to the Listen Up podcast. We'll see you again next time, and be sure to click subscribe to get updates on future episodes.